Hi, everyone. Welcome to the Creative Confidence Podcast. I'm Suzanne Gibbs Howard, founder of IDOU, and I am excited that you are here with us today. I always have a conversation with special guests on creativity, leadership, innovation, and growth. And we always open up the last part of that conversation to you, our community, so that you can get answers to your own questions. I invite you to get started participating in the conversation right now. Go ahead and introduce yourself in the chat and let us know where you are today. I am thrilled to have you all here. And we have a great conversation for today. We are going to be talking about areas that sometimes are thought of as so-called taboos. They're areas where needs are unspoken or difficult to discuss. And so these make them tricky areas for innovation. We'll be having that conversation with Kerry O'Connor, who is my special guest today. She's one of the instructors of our Designing a Business course. Welcome, Kerry.
Thank you. I'm so happy to be here.
And Kerry and I are going to talk about why these areas often get overlooked, what opportunities they hold for design and innovation, and then especially how you can proceed with understanding these areas and creating a business that can really do some good in the world and have some success out in the marketplace. Tiny bit about Kerry before we dive in. Kerry is an entrepreneur, a design practitioner, and a startup advisor. She's launched multiple new ventures, some of them in the US and some of them in Asian markets. She also teaches a graduate level course at Stanford's Design School. And in the last few years, she's gone particularly deep in the space of healthcare, especially women's health needs. And this is where she's gotten interested in designing for unspoken needs. So, Kerry, I thought we'd dive right in by talking about, when I say taboo spaces and spaces that are tricky to talk about openly, what's the range of areas that come up for you?
Yeah, I think the range is quite large, and mostly they're things that all of us have experience with. So things like your sexual organs, right? And what happens to them and what you do with them. Things like human waste and the body parts that go along with that. Actual trash and waste from your household. Then on the sort of tougher side, things like addiction, mental health, and even something as ubiquitous as money. Like if you think about how unwilling people are to talk about how much money they earn, like that is also something where there's so much sort of social norms around not talking about that. So it's a really broad range of things that fall into this category of what is unspoken.
Yeah, definitely. And if any of you kind of felt your body just like clench up or move back at the very mention of some of these topics, that is precisely why there's such tricky areas to bring about great design and great innovation. I invite the community. We've got people from all over the world joining us today. If there are things that you're working on that you find are these spaces of unspoken needs, go ahead and share them in the chat today. We'll get the discussion going there as well. But Kerry, how did you get interested in design in this space?
Well, I studied anthropology, loved sort of understanding people, and really, even if you talk to psychologists, there's this idea that on a really human level, like when there's something that people are uneasy talking about, they often think that they're the only ones going through it. But in fact, like the human experience is only so big. Like it really means that there are a ton of people experiencing it. And when there's a problem that's that big, there's so much potential to help people with things that are so important to them, that are really affecting their lives, and to have a kind of large impact there.
Yeah.
And with that, it also means that there's a huge business opportunity. So my sort of business brain gets really excited at, when you're solving a deep need, like people are so hungry for that in their lives. So that means there's real potential for a for-profit business.
Yeah. So true. And I can see other people, Lucy's sharing another area that's a tricky one to talk about: food insecurity, especially with people working in the spaces of food. So thank you for sharing that. So I know today we wanted to get into this topic. We love tangible examples, and you have an amazing one to share, which is a company, Materna Medical, that you have
Mhm.
been a part of off and on for a decade. And so I wonder
Yes.
if you could just share with us a little bit about what has Medical become today?
Mhm. Yes. So I was super fortunate to be part of this company for a good portion of my career. So Materna Medical is a really novel OB-GYN or obstetrics gynecology platform. And it's working in a $6 billion market in the most common pelvic floor conditions that women face. So to make that a little bit more concrete, Materna's first product is Millie, which is a revolutionary expanding vaginal dilator. It received FDA clearance in 2021 and is there to treat the symptoms of overactive pelvic floor disorders called vaginismus. And what that creates is painful sex. So that's one product. The second product, PrEP, is a clinical stage device, and that aims at reducing pelvic floor injuries during childbirth. And what's really wonderful is that in the pilot study, the PrEP has already reduced pelvic floor injuries by 60%. So it's wonderful to see these products coming to life that are really helping women.
Yeah, incredible. And I think we can imagine, like in this discussion, there's this attraction and like retraction from these topics all at the same time, that they're so important. They're things that so many women deal with, and yet at the same time, tricky and painful to talk about.
Mhm.
Um, I wonder if you could talk to us a little bit about how you got started in the specific work that ultimately became Materna Medical.
Yes, yes. Oh my gosh. Well, I was very fortunate to be part of this biodesign course at Stanford. Um, and what that course does is it starts with a clinical need. And what they presented to us was that about 90% of women tear the first time that they deliver a child. And I was horrified by that idea that not only do you have a newborn to care for, but now you have this trauma to your body and you have to recover with a wound. It just seemed really sort of viscerally wrong to me that we were all just sort of standing by and letting that happen and just being like, oh, well, that's part of the process. So the way that the course worked at the time, it was sort of like a science fair, and you would research the topic, and anything that affects 90% of women like is a massive market. So based on that science fair and sort of the pitch I was able to do, was able to gather a team of people around it. And in the biodesign class, it's focused on creating a medical device. And we sort of had this glimmer of hope that a device would be able to help, because when you see that more than 90% of women will tear the first time they deliver a baby, those rates dropped dramatically to about 60% the second time, which tells you that there's something to stretching that tissue, which meant that there could be a solution in there. And so we started working on it, and it was really exciting. But then it was the same time that I sort of stumbled into this world of design and design thinking, and I got dazzled by that. So I went and took the full-time job at IDEO, and thankfully my classmate at the time and co-founder went on to keep working on Materna.
Wow. And so then now fast forward for us like 6, 7, 8 years down the road.
Mhm.
Your colleague kept working on it. Then what happened? How did you get re-involved again?
Well, so my colleague is a biomedical engineer, and he and another engineer were very focused on getting the device to work. If you think about your pelvic floor muscles, that is what holds all of the organs inside your body. They are very tight. And so figuring out how to safely and predictably stretch that tissue was quite the difficult engineering challenge. But as they were working on that childbirth device, what they realized was that there was an opportunity to use that same knowledge and technology to stretch women's vaginas gently outside of the hospital environment. So it became clear that there was an opportunity that a lot of women have this pelvic pain, and the therapy for them is to do dilation, a few times a week. And so the idea of creating an expanding dilator where you only have to insert it once and you can gently stretch the tissue depending on how you feel, felt like a really large opportunity. So I came in and brought all of my design thinking to be able to think about, who's our audience here, right? What would make them feel safe and interested in this product? So I got to do all of the sort of fun design thinking parts, and my fabulous colleagues did all of the difficult part of figuring out what is inside the product.
Yeah. Wow. So interesting. There's somebody in our community just said, I wonder how many guys just dropped off this call. And I know you and I have discussed a little bit about this, like the challenges that we have with getting funding to businesses for women's health and why that's a massive business opportunity. Can you share a little bit about what you've seen there in your work in women's health?
Yes. So I think the world is waking up to women's health as an opportunity, right? When half the population has a certain body type, and for better or for worse, goes through a really sort of clear set of experiences in their lifetime, it is a massive opportunity. And yet we know that about 96% of venture capitalists are male. And I know that when we were doing fundraising early and we talked about this, expanding dilator, some of the reactions we got were like, is that necessary? Like, this seems like a nice to have, right? So it's just sort of the limits of our abilities as human beings to empathize with and to try to understand what it means to be in a different body. Like, that is so hard to do. But now, more women are getting into venture capital, more people are understanding either through partnership or through, just sort of seeing the number of companies that are coming up in this space. What a magnificent opportunity it is to both make money and help women have their bodies work better. So It is really exciting to see this space coming alive.
Yeah, that's the whole point of today is we will talk specifically about this one. And then our goal is to get to the end of the conversation and talk about some generalizable principles that you can use for other areas that have this dynamic in them. So one more thing before we dive into maternal medical even deeper, Kerry, there's a framework that you use when you teach the Designing a Business course that's just super helpful. I use it all the time to logically move through the steps of designing a new venture. Can you just introduce that to us?
Sure. So obviously, as a business designer at IDEO, and now like out in the world, deeply believe that you can design a business and a business model just the way you would design a product or a service. So the sort of three parts that we think about are to create value, to capture value, and then to deliver value. So by creating value, that is understanding needs and figuring out like what is the value proposition that you can offer. Capturing value is about designing your revenue model and understanding the pricing that you can, like the price you can charge folks. And then delivering value is about how do you bridge that gap between you having something wonderful to offer and where people are. So what are the channels where you find the audience that you're selling to?
Nice. All right, great. So we're going to leverage that to think about maternal medical and talk about some of the wise moves that you made and tricky turns. So if we talk about creating value, so uncovering human needs, spotting great opportunities for design, for impact in the world, for business, and you're in this tricky space where it's hard to get people to open up and talk. Can you share a little bit about some of the things that you did in those early days to help your team make progress?
Yes. Well, one of the things that felt kind of clear, my co-founders, who were still working on the company were men, and they didn't feel like they were going to be able to approach our users who are all women. And I'm also sensitive to the idea that like not everyone with a vagina, identifies as a woman, but I'm just going to use the term woman to sort of, be a blanket umbrella here. So it was clear that, me coming in as a woman and being able to empathize with just having the same body parts was a nice starting point. But I have not had the same, difficulties that the women I was talking to did. So there was definitely a gap there where I couldn't say, hey, I've gone through this too. But one thing I found that really helped women was me starting to share stories that I learned from other women. So like one woman was 27, had not been able to have intercourse. And she said to me, like, a little part of me thought it was just me who was defective. And for me to be able to come to her and say, no, like, I can tell you it's 1 in 18 women who suffers from this. People aren't talking about it, but there are so many other people who are having the same experience you are. And being able to, while I couldn't identify from my own personal experiences, but being able to build on one of her experiences with a story I heard from another woman really helped people feel like, oh my God, I'm not alone. And it, based on not being alone and not being sort of like the weirdo, they were more willing to share what they were experiencing and what their fears were. I mean, I talked to a woman who had gotten a divorce after about 40 years of marriage, was single, and, because of this pelvic pain, was not able to have intercourse and was so afraid that she was going to spend the rest of her life alone because of it. And I said to her, well, who do you talk to about it? Who in your life knows? And she was like, oh, no one knows. She's like, talking to you is the first time I've discussed this with someone. Yeah, right. And that's a horrible place to be as a person. Like, that is so isolating when it's something that's happening to your body that's not your fault.
Yeah.
So being
to
able
go
to
forward with that depth and empathy and the ability to help people have these conversations, even that is, so powerful.
Yeah.
So wise moves early on to help people open up with sharing stories. Then as you moved forward, as you're entering the capturing value phase of your work, here, this is, so many things about prototyping, the business model, the price, but also the product. And I know when you saw some of the earliest prototypes, you had a particular reaction. And I wonder if you can share that and then talk about what you did with as a company.
Yes. So I deeply love and respect my engineering colleagues. But of course, they were looking at the problem of how do you create an expanding vaginal dilator from an engineering perspective. And when I saw it, it looked like something that would live in your garage. It did not look like something you wanted in your bedroom, which we know about like 95% of the women who use this product use it lying in bed. So it was really important to start to change the visual look of the device so that it would not feel intimidating, so that it would not feel like scary, so that people wanted to invite it into their routine. And sometimes, people would say to us, like, why don't you just make it look like a penis? It's essentially trying to do the same thing. And, I mean, many of the women I talked to had dealt with sexual trauma. And so it was very important to make this device not look masculine in any way. And then there were sort of functional details we had to think about. So again, if you think about someone lying in bed using the product, they're not going to be able to see the controls. So how do you help someone feel in control of a product when they can't really see what they're doing? So it was a really, actually, it turned into a really fun design challenge to make it functional and beautiful and discreet at the same time.
Yeah. I know there's more. So if it comes up that you did some really interesting things with ethically testing out this, we'll save that. Hopefully, if people want to hear more about that in the questions and answers. But I want to make sure that we talk a bit about the business model prototyping. I've always valued you as a design colleague because I think you're so creative about particularly pricing tests and prototyping. Can you share a little bit about what happened with Materna Medica as you were figuring out how do you put a price tag on something like this?
Yes, it's such a great question. And it's such a tricky question because hopefully for everyone listening, like what you're trying to do is to create something that hasn't existed before. And so when you're creating something that you think is more valuable than what's on the market, how do you price it when you haven't quite proven yet that value is there? So I think, when we talk about prototypes, it starts as early as telling a story. So as we were developing the product and talking to people about what they'd need in the product, I would start to sort of flinch test people by saying like, okay, what if it cost $300? What if it costs $200? What if it costs $100? And just starting to see their reactions and understanding their own mental math and what they were comparing this product to. Were they comparing it to an electric toothbrush? Were they comparing it to the years they had spent trying to find doctors to help them and the amount of money that they had spent on all kinds of alternative products? So it was really starting with the sort of lowest level prototype of talking to people. Then we did set a price, and someone on our team thought the price should be lower, right? And again, for everyone listening, there's a real tension of, do you have it be lower price so you can reach more people, or do you really try to capture as much value as you can and know that with a higher price, you're going to lose some people, but with that difference between where you want to price it and where, that lower mass prices, you really want to keep that difference because that is meaningful to your company. And so the way that I approached that was we kept the price high because obviously once you lower the price, it's very hard to raise it again. And what we did was we offered a $50 rebate. So the sort of difference between the higher price and the price that someone thought, was going to be the better price. We offered a $50 rebate there for someone who would take a survey before they started using the product and then after 3 months. And what we saw by doing that was about 80% of people were very happy to pay the full price and not spend their time taking the survey. So that said to us, like, okay, we're pretty good at this price. It also felt like a real win-win because for the folks who did want that discount, we then were able to get data from them, from those surveys that we could then publish to show the medical community the efficacy of the device. So It was a really lovely way to start to prototype pricing.
So creative. And for having launched new products and offers into the world, it's so tricky when you're doing something quite new to figure out how to nail price. And you always want to play with things. And I love that idea of using the rebate for survey participation as a technique to experiment. Very cool. Very cool. So that we've talked about creating value, capturing value. And then when we talk about delivering value, this is all about bringing that product to market. It's definitely about channel, but also about everything else that goes around it to get it productively into people's hands. And so can you talk about some of the things that you and Materna Medica did to sensitively deliver these devices to market?
Yes, there's so much here around, right? Like for entrepreneurs and anyone who's like within a business and launching something new, how do you frame that up? How do you talk about it to your audience to make sure that they see themselves in the product? And so it was very clear that women who had this kind of pain were going to the medical community and looking for help. And the folks advising us on the design of the device and how it needed to work were a set of fantastic medical doctors and pelvic floor physical therapists, like people who really understood this anatomy. And whenever you hear those folks talk, they talk about patients. But what became really clear when I was talking to women is that they did not think of themselves as patients at all. And the way I think about this is like, if you trip and fall, or if you're in some kind of accident and you tear your ACL and you need to get surgery and sort of fix your knee, you look ahead and you're like, okay, I'm going to get surgery. I'm going to have physical therapy. Then my knee's going to work and I'm going to move on with my life. And you don't really think of yourself as a patient, right? You think this mishap occurred and you are going to, with a program, get back to health. And that's how the women who were using our device felt. They didn't feel like they were part of a medical community. They felt like they were encountering this problem in their bodies. And so it became really important to us on the website and whenever we talk to people to call them women and to not call them patients.
Yeah. So that language is so key. And I can imagine all of the brand, all of the tone of voice around these things.
Yes.
There's one other thing I want to ask about in this space of delivering to market, which is channel. And I know there were some tricky decisions to make, as there always are in an early stage venture, about how do you get this into people's hands? Do you go directly to customers or do you go through their doctors? Could you share a little bit about some of the tips and turns that you had to take there?
Yes, this is another sort of being a new entrant, right? How do you handle this? And, for anyone who cares about and studies innovation, the place that you sell your products is such a wonderful way to be innovative and disruptive. So knowing that a lot of people were going through their healthcare practitioner to understand what was going on with their body, there was a channel where we could say, okay, let's go to doctors, let's go to physical therapists, and knowing that those people would be nodes in a network, right? One doctor is going to have scores of women, and we can then reach all of those women through one doctor. So that felt very sensible. And yet, right, talking to all of these women, knowing that they have had a difficult time in the healthcare system and have been searching for products. We had so much organic search around the term expanding dilator, because it's a pretty sensible product, right? If you need to stretch something, the idea that the product would do the stretching makes a lot of sense. So there was this very attractive idea that we could go directly to the consumer and talk to her directly and, have that relationship with her where we're helping her figure out how to use this product and how to have a great experience with it and just get through this part in her life to feeling better. So the way that we handled it, because we were resource strapped and really young as a company, is we did a little bit of both to see which would be fruitful. So we had a few physical, pelvic floor physical therapists that we went to, and went through the sort of task of educating them on how to talk about the product, how to make sure they were getting good results with their patients, and then doing experiments around advertising, online, because there is something really special about this space and where people are experiencing these things that are unspoken, that do feel like taboos. This is where the internet is wonderful. They will search out and they will find people who know solutions. They will dig to get to solutions. So it's an audience that was actually really hungry for our product. And so we were able to also sell directly to them and see how those sales sort of tracked against going through healthcare providers.
And that was your test then. You could kind of try both markets for X amount of time, get your data, and then figure out, okay, you'll always in the early days of the company have to prioritize one and then come back to the other one a little bit later. So yeah, super important. And I love that. That's such a great experiment. There's one more thing I want to get to before we dive into some of the questions. So please, everyone, keep asking what you've got. We'll get through as many as possible. But I know we've gone deep on Materna Medica, but really want to think about some of the takeaways that people can use in all sorts of topics. People in the community are saying they're dealing with aging and aging relatives. They're dealing with discomfort in the workplace around certain topics. So what are some of the takeaways that you think we can generalize out from your learnings at Materna Medica?
Oh, absolutely. Yes. So you could definitely sort of abstract from here. And I think one of the first lessons is about building empathy with your audience and knowing that it's not all coming from you, right? So you don't have to be responsible for having all of the same stories, right? Knowing that you can start to share the stories that you're hearing with your users. Being similar to your audience in some key way, like for me, it was being a woman, but I couldn't empathize with the condition. I think having something in common where you can use that to start to build trust and build rapport is really nice. And also around building empathy, you can start to leverage the people that you've already built trust with and ask them if they know anyone else that would be good for you to talk to. Because often with these topics that are so difficult to talk about, the folks who have gone on the internet and have sought out community, they have trust within those communities, and they can be your ambassador to help get you into those communities as well. Other things I think about when looking at this space, pricing is quite elastic in this space. So I would encourage people to do experiments because these problems are so deep for people, because they're not talked about. There can be a lot of sort of shame or embarrassment involved. And so they're really acute problems that people want to solve, which means you could have a good deal more pricing power than you expect. So I would encourage people to prototype there. The third thing is the product is one thing when you go to market, but there's a whole experience that you want to think about. So I talked about, us thinking about our customers as women and not patients, really making sure that your offer is only a small piece of someone's identity and understanding how it fits into their life, thinking about the entire experience, not just the product, but how does someone use it? How can you make their experience using it even better? And then really understanding how do people view this topic and how do they relate to this sort of sensitivity, and using that to design the experience that you're trying to create. And then
Wonderful.
the last thing,
Yeah. Keep going.
yeah. No, the last thing, again, because this is such a tricky area, even Suze, you inviting me here and me being able to say the word vagina on a podcast and talk about pelvic pain and people understanding that it's 1 in 18 women, as a company that is designing for these folks, how can you get a little bit more of a spotlight on these causes so that, people will not only know that your product is there and not only start to use it, but will start to feel a little bit better about the moment that they're in.
Yeah, absolutely. I love that way of thinking about this, that this is a great way to do good in the world while providing products and services that can really help people. Let's get to some of the questions. There are a bunch of questions that people are asking around finding these people and information about them when they're hard to talk about. So maybe starting with that, how did you find the earliest people that you were talking to and interviewing about their needs?
Yeah, so I will say that we got to a beta where we started selling the product. And once we started selling, it was really easy to ask people if they would have conversations. But the step before that, which is what folks are interested in, is how do you find someone? Like I said, we were really fortunate to have a fantastic set of advisors. And so talking to those medical advisors and saying, hey, would you ask some of your patients if they'd be willing to talk to us? Would you ask them if they'd be willing to use an early prototype and give us feedback? So again, it was sort of using those nodes in the network to try to get to the people that we were most interested in hearing from.
Yeah, that's so great. And I found personally working in topics like this, that in the early stages, you might have a more intimate group. You need to carefully construct that group so it has breadth to it, but you're going deeper with a few people in the early days just to get going. And then you start to broaden out and get your numbers over time. Which brings me to another question people are asking. Meru asked this last, but a couple others are saying, how do you get the data? Then, you shared some pretty powerful stats that you used in those conversations to develop empathy and rapport and help people open up. How do people get data for challenges like this?
Oh, well, there's both the sort of medical sanction data and then the anecdotal. So, going to PubMed, going to sort of government sources, there's a ton that talks about these conditions and how many people are suffering from them. So something like urinary incontinence is another one of these things that so many people experience and very few people talk about. There are surely stats out there that talk about, how pervasive an issue that is. But then also, again, talking to these doctors and saying, what portion of your patients are talking about this? Talking to some of the women who are going through it and understanding how many doctors did they see and what were the types of doctors. So that also led us to figure out who are the types of specialists that we need to be talking to, because we were able to sort of shortcut our journey to those people by talking to the women who had gone through that journey themselves. Yeah. So there are a lot of sort of formal and informal places that you can go talking to experts is a great way to start to get a sense for how big a problem is.
Yeah. And there's a follow-on question to that. Tennyson's asking, how did you get time with doctors and specialists to explore this?
Well, I would say to anyone who's listening, who's like kind of interested in pursuing a new area, friends and family are a great resource. LinkedIn's also amazing because you can see if you're connected to anybody. But I find usually doctors went into this to make lives better for patients. So if you're coming with a really great sense of curiosity and a solution in mind, I've found people really willing to talk. But then, if I think about Materna, we also got to the point where we had more formalized relationship with a set of advisors who were experts in this space as well.
Yeah, I absolutely agree with that. I think in the early days of a new venture, having that team of advisors and having them, their skin in the game can be mental and emotional as well as financial, but it's just such a great way to have people there to constantly phone a friend when you have details you need to lean into or networks you need to leverage.
Absolutely.
Couple more questions about how to have these conversations in the workplace. And I know there's some interesting things that you were sharing with me, even as you were working with this team of engineers. You had concepts and prototypes that needed to be tested, and you're trying to carry some of these things forward. How are you talking about the ethics of that with your colleagues and carrying those conversations forward?
Yeah, it ranged because if all of us think about our workplace, like we want to be in a workplace where there is both like passion and concern and care and levity. So I will say, like, there were a lot of vagina jokes, not about the women we were trying to help, just like, I mean, when you say the word vagina 30 times a day, like you start to joke about it. And like, that is kind of wonderful. But then on the side of really trying to understand the problem and make sure that we're doing things ethically, there is a really important space and time when you are testing a product on someone's anatomy that you are not sure if it works. And obviously our healthcare system has figured out how to do this with bench tests and then models, and then you finally get to people. But it feels very heavy the first time you're asking someone to use the product, right? Because you want to make sure that it's safe. And then, then efficacy comes next. So in that case, we were creative, like both in being a founder, I was willing to raise my hand to test things. And then there are even services where women are willing to be sort of the testers for this. Like for every woman out there who's ever had a pelvic exam, if you think about, like, there was a point in time in which your doctor had to do their first exam, there are people that are sort of paid to be patients in that situation who know how to give a doctor like really articulate feedback on what things feel like and what they're doing. So we were able to find what we believed were really ethical ways to ensure safety and to get to testing in a way where there was a ton of consent.
Wow. Very cool. Very ethical. And I love how you're sharing the honest truth of walking that fine line between being able to take a deep breath and have some levity around these tricky conversations when you're in the workplace, and yet doing that still with deep respect for and ethics around the patients that you're caring for. Any other, I think there are lots of questions with people asking for any other tips around building empathy with these patients. Anything we haven't covered so far?
Well, one thing I would think about, and I see this, when I talk to startups, I think this is in pretty much every business. Everybody who's working on a product gets so entrenched in it. And you find that about a topic area, about your product so well, and you want to talk about that. And I think in your time talking to your end users, it is so important to be in a posture of curiosity and not knowing. Because I think about, like with our product, one example is that we knew people were going to doctors and physical therapists, and that's why they were being told to buy Millie, to buy our dilator. And then I'd have conversations with these women and they'd say, it's not working. And I'd say, well, tell me about your routine. And it turns out they were using it once a week. So like if you think about preparing to run a marathon, running once a week isn't going to get your body there. But no one had told them how long and how often to use the product. And that's only because we went in and started having conversations with people where we were curious, right? We weren't just like, how, like, what do you think of the product design? Like we were there for an open conversation and acting as though we didn't know what we knew, that those kind of insights were able to come up. So I would say for anyone listening, even if your product is something very straightforward, it becomes so important not to approach a user as an expert yourself, even though you know so much. It's a tricky balance.
Yeah. Yeah. Fascinating. That's so helpful. There's one more question I'm curious about. We talked a little bit about your choices about the channel, and Allison's asking, outside of pricing, she's thinking about access. Is there any interest in expanding your audiences to reach people who might not have access to healthcare practitioners? There might be a gap there. And I know you're so wise about the business model, and then at the same time wanting to reach and help the most massive number of people. Can you talk a little bit about the trade-offs and decisions and strategy you've had to work through there?
Yeah, that is a really difficult trade-off, I think, for any business. There is the reason that you got into the business, which is to help as many people as possible. And then there's how you set up your business model to be sustainable. And sometimes that can mean sort of, right, like in the decision for us about going direct to consumers, and the amount of sort of equity of access there through the internet is brilliant. Like you can feel really good about that. But then thinking about going through healthcare practitioners and making sure that people are going to have a good experience with the product, and that they're going to be using the product for the proper condition, right? Which if someone goes and buys the product and they actually have something else going on with their bodies where this product's not appropriate, that could be harmful. So it becomes a really difficult sort of set of trade-offs to start to weigh between access and like responsibility on one side. And so I think, as people start to figure that out, like at IDEO, we talk about integrative thinking, which is like, how do you bridge that gap? How do you take the best of both sides of that? And I think that can be designed, but again, it means creating something new, right? It might mean selling direct to consumers and like potentially giving them the name of their nearest healthcare practitioner that could help them ensure that before they start using it, it's appropriate to their bodies. So I think, for everyone who's listening, like for everyone with that designer mindset, it's actually an opportunity to start to do things in a new way because you're new to this space. So you get to rewrite the rules.
Yeah. Yeah. So true. And I think there's so much there also about when you're working with a new venture and nobody ever has endless funding or very rare. How do you say, we want to get to that? But I always have a long no, not now list.
Yeah.
We want to get to it and we will eventually, but we've got to tackle this first and then that second, and then we can get on to our bigger dreams. Sometimes that can be the epicenter and sometimes it has to be not right this second. So
That's
important.
So
Last question. I always get the last question, but there are so many good ones. I'm going to give this to the community today. People are asking, when you're dealing with unspoken needs, what's easy to miss, or how do you get to those unknown unknowns?
Oh gosh, I think that is such a good question, right? Because you go into a conversation with your own questions and curiosities based on what you know, not what you don't know. I think about the sort of IDEO and like design thinking approaches of asking why, and saying like, is there anything we didn't talk about? They sound very small, but they can really open up such a bigger conversation. And I think even asking what haven't we talked about at the end, like after you've built up that trust, after you've shared stories, after you've made someone feel heard, can lead you down paths that you didn't know were there.
Yeah. We always say, like, close your notebook and all the good stuff comes out after you're done.
I know, as soon as you hit stop on the recording.
Yeah. Well, thank you, Kerry, for everything that you shared today. Thank you to our community for joining us in this uncomfortable space, because we know there's important work to do there. We've been talking with business design and innovation on taboo topics, or topics that have unspeakable needs, with one of the instructors of our most popular course, Designing a Business, Kerry O'Connor. If you'd like to learn more about the themes today, check out Kerry's course, Designing a Business, at idou.com/business design. Thank you so much, and see you again soon. Bye.